my mid-20s, I started to get the idea that I was going to need to transition from female. At the time, there wasn't a lot of information, so in looking around, I knew I had options, and some people decide to pursue medical options, some people don't.
I work at a place where I am covered by health insurance, but actually accessing the specific medically necessary health care that I need isn't available because of the explicit exclusions within the insurance policies.
My experiences trying to access healthcare have been kind of up and down, tumultuous, because there's the threat of losing my health insurance or all of a sudden not getting the kind of care that I need.
I worked for 30 years as a machinist. I made a good salary. I happily paid into Medicare all my life, and now it was being denied to me. It's just unimaginable to not be able to get the benefits that you paid for all your life.
I found a lot of employment discrimination. I found it was very difficult to get a job or even an interview. My education and my work history was under my female name and as a woman, and then at some point had to, start building a work history as male. It was very difficult to find steady employment or full-time employment, and when I did get my first kind of full-time job, office job, it happened to be, I remember I had medical insurance, which is great, and they mailed the policy, and it's an inch thick, and no one ever reads those things. And I remember looking through every page trying to see if they covered trans or gender-related medical expenses. And I remember there was one paragraph that explicitly said, we won't cover anything for transgender patients. And reading that felt like being punched in the stomach. It was one of those things of, it felt like being singled out. It felt like them saying, we would provide this for anyone else, but not for you.
I was in practice for 36 years, and I guess for about the last 15 years of the practice, I was taking care of transgendered patients. It was really very offensive to me to not be able to provide care for what is recognized as a medical condition. The AMA has said this is a recognized medical condition. It's in all the diagnostic code books. And yet, if I would list the code for gender dysphoria, which is the code for being transgendered, when a patient would come in for an office visit, almost every insurance company would specifically deny payment for that. I think it's really outrageous that insurance companies will pay for other recognized medical conditions, but they specifically exclude this one.
As a preventative measure in care, it would have saved me a lot of costs, a lot of health costs. It would have saved society in general a lot of costs.
My personal experience with the cost of health care, I can't speak for everybody, but in the 6 years that I was wearing my chest binder, it ended up shifting and moving my ribs around, and I did end up going to the emergency room 2 or 3 times. And when you go to the emergency room with chest pain and you can't breathe very well, you're pretty much fast-tracked. Even at 27, they think you could be having some kind of heart problems, and so they do all these tests, and it really racks the money up a lot. It doesn't make any sense to me to cover something 2 or 3 times going to the emergency room opposed to covering something once, which is the surgery.
Multnomah County was the first jurisdiction in the state of Oregon to provide transgender health benefits. When we started looking at this, a lot of people who were pushing back on this were concerned about the cost. How much was this going to cost the taxpayers? How much would this cost the county? The reality is it cost virtually nothing extra. It had almost no impact whatsoever on the cost of our healthcare delivery system at Multnomah County. We all know that when your employees are physically healthy and their mental health needs are taken care of, they're going to be more productive, engaged employees. And so it's good for the bottom line.
Many people have difficulties accessing the care that they need. But as someone who's transgender, being able to access health care and being denied because of that gender identity disorder is a huge piece. And I can't imagine not having that as a concern, how that would help me to just, that would be such a load off my mind as far as being able to just be more present and just be more in my body, which is something I think that a lot of people take for granted.
You just can't get past that. Walking out the door every day, feeling uncomfortable every single day, having to put a binder on every day that just, it hurts you. And it's not something that anybody should have to go through. It's something that people go through because there is no other option. But when you have the option to get it taken care of, it's life-changing. It's really something that you can never describe what it feels like. It's just something that people are finally themselves, they're finally whole, and it's indescribable, really.
There are people in our community who have very specific physical health and mental health needs, and we should address those needs along with the other physical and mental health needs of the community. So there's a social justice issue. It's the right thing to do.
Everybody at one point or another is going to meet someone who is transgender, whether they can recognize them as transgender, whether the person is already quote unquote passable, or whether they're fighting to become who they want to be.
We want the same things. We want to have a family. We love our families.
Not having health care access impacts how you can get a job. It impacts, your job then leads towards housing discrimination. It just becomes this huge snowball effect in that you're wanting to just be able to access medical care, but then it just impacts your life. Everything about your life is impacted by the not being able to access health care.
I've had my struggles, I've made mistakes, I've had my joys and my successes, just like you. And I think that everybody, including myself, deserves the chance to be happy and to be healthy and to be successful, just like you.
If I didn't have to go through the hoops, if they actually covered everything I needed as a transsexual woman, that would be like, it's like freedom. It's like the cage door opening and finally being able to fly out and just totally live as who I am.